Do you know what prostate cancer is? It's a medical condition that affects the prostate, a small gland about the size of a walnut tucked away inside the male reproductive system. This little gland has a big job, producing seminal fluid that nourishes and transports sperm. When something goes awry in the cells of the prostate, it can lead to prostate cancer, one of the most common types of cancer in men. It's a prevalent concern worldwide, making it a crucial topic to understand. Why, you ask? Because knowledge is power. Knowing about this disease, its causes, symptoms, and treatments can help in early detection and potentially save lives. So, whether it's for you, a loved one, or simply to be informed, it's essential to understand this disease. Understanding prostate cancer could be a lifesaver, and the first step is knowledge. Let's take that first step together. So, you may ask, what causes prostate cancer? Well, the truth is, the exact cause of prostate cancer remains a mystery to scientists. Despite countless studies and research, we're yet to pinpoint a specific cause. However, what we do know is that prostate cancer begins when cells in the prostate become abnormal. Mutations in the abnormal cell's DNA cause the cells to grow and divide more rapidly than normal cells do. Where normal cells would die, these abnormal cells live on, creating a buildup that forms a tumor. Even though we don't know the exact cause, we've identified several risk factors that could increase the chances of developing the disease. Age is one of them. Prostate cancer is rare in men younger than 40, but the chance of having prostate cancer rises rapidly after age 50. Race is another risk factor. For reasons that are still unclear, Black men carry a greater risk of prostate cancer than men of other races. They are also more likely to develop aggressive forms of the disease. Family history also plays a part. If men in your family have had prostate cancer, your risk might be increased. Also, if you have a family history of genes that increase the risk of breast cancer, BRCA1 or BRCA2, or a very strong family history of breast cancer, your risk of prostate cancer might be higher. Diet could also contribute to the risk. Men who eat a lot of red meat or high-fat dairy products and consume fewer fruits and vegetables may have a slightly higher chance of getting prostate cancer. But remember, having a risk factor, or even several, does not mean that you will get the disease. Many people with one or more risk factors never get cancer, while others who get cancer may have had few or no known risk factors. While we can't pinpoint a specific cause, these risk factors increase the likelihood of developing prostate cancer. What are the telltale signs of prostate cancer? It's a question that many men may find themselves asking, as this disease has a way of creeping up unnoticed until it has advanced. As we delve into the symptoms of prostate cancer, it's important to keep in mind that not all men experience these symptoms. In fact, prostate cancer can be symptomless in its early stages. Nevertheless, being aware of the potential signs can lead to early detection and improved outcomes. One of the first symptoms that may raise a red flag is difficulty in urination. This could manifest as a decreased flow or velocity of urine stream, or a need to urinate more frequently, especially at night. Another symptom to look out for is the presence of blood in the semen. While this can be quite alarming, it's important to remember that blood in the semen doesn't necessarily mean you have prostate cancer. It can be a sign of other conditions too, including infections. But it's a symptom that should never be ignored and should prompt a visit to the doctor. Discomfort in the pelvic area is another symptom that can point to prostate cancer. This discomfort could be persistent or come and go, and it could range from a dull ache to sharp pains. Again, other conditions can also cause pelvic discomfort, but it's a symptom that warrants investigation. Lastly, bone pain can be a symptom of more advanced prostate cancer. This is because prostate cancer can spread to the bones, causing pain and fractures. The pain could be localized or widespread, and it could come and go or be constant. In summary, difficulty urinating, blood in the semen, discomfort in the pelvic area, and bone pain are symptoms that could point to prostate cancer. But remember, these symptoms could also be signs of other conditions, so it's crucial to seek medical advice if you experience any of them. Early detection is key, so never ignore these symptoms. It's a mantra we should all live by when it comes to our health. Because the earlier prostate cancer is caught, the better the chances of successful treatment. How do doctors diagnose prostate cancer? Well, it's not a one-size-fits-all process, but rather a series of steps and tests that help doctors determine whether the prostate changes are indeed cancerous or not. The first step in this diagnostic journey is usually a PSA blood test. PSA, or prostate-specific antigen, is a protein produced by the prostate. An elevated level of this protein in the blood can indicate prostate cancer, although other conditions like prostatitis or an enlarged prostate can also cause a rise in PSA levels. It's important to remember that a high PSA level doesn't confirm cancer, but it does signal the need for further testing. A digital rectal exam, or DRE, is another tool in the diagnostic arsenal. In this procedure, the doctor physically checks the prostate for any abnormalities. While it may be a bit uncomfortable, it's a crucial step in identifying potential issues. Again, an abnormal DRE result doesn't necessarily mean cancer, but it does warrant further investigation. If these initial tests suggest a potential problem, the next step is typically a biopsy. In a biopsy, small samples of prostate tissue are removed and examined under a microscope. This is the only definitive way to confirm the presence of cancerous cells in the prostate. The biopsy can also help determine the aggressiveness of the cancer, which is crucial information for planning the treatment approach. Once all these tests are completed, the doctor will have a comprehensive view of the situation. They will discuss the results, potential treatment options, and the next steps with the patient. This is a crucial conversation, and it's important to ask any questions or voice any concerns you may have. And so we've come to the end of our exploration of how doctors diagnose prostate cancer. It's a thorough process, but an essential one, as early detection can significantly increase the chances of successful treatment. Remember, a diagnosis is not a death sentence. It's the beginning of a journey to recovery. How is prostate cancer treated? This is a question that weighs heavily on the minds of many, and today we're going to shed some light on it. When it comes to treating prostate cancer, there isn't a one-size-fits-all approach. Each case is unique and requires a tailored treatment plan. Let's dive into some of these options. Firstly, there's surgery. This is often a go-to for localized prostate cancer, that is, cancer that hasn't spread beyond the prostate gland. The most common type of surgery is a radical prostatectomy, where the entire prostate gland and some surrounding tissue are removed. Next, we have radiation therapy. This treatment uses high-energy rays or particles to kill cancer cells. There are two main types: external beam radiation, which is like getting an X-ray, and brachytherapy, where radioactive seeds are placed directly into the prostate. Then there's hormone therapy. This isn't about destroying cancer cells, but rather, it's about controlling them. Prostate cancer cells need testosterone to grow. Hormone therapy reduces the body's testosterone levels to slow down or even stop the growth of these cells. Chemotherapy is another option, especially for advanced stages of prostate cancer. It involves the use of drugs to kill rapidly growing cells, including cancer cells. Immunotherapy, the new kid on the block, uses the body's immune system to fight cancer. It's a promising field, and ongoing research is looking at how to best use this treatment for prostate cancer. But let's not forget about the importance of a healthy lifestyle and regular checkups in managing this disease. Eating a well-balanced diet, staying physically active, and keeping up with regular screenings can make a world of difference. In conclusion, the treatment of prostate cancer is a multi-pronged approach that depends on the stage of the disease, the patient's overall health, and their personal preferences. It's essential to have open discussions with your healthcare team to make the best decision for you. With the right treatment and care, prostate cancer can be managed effectively. So chin up and march forward, armed with knowledge and hope. To recap what we've discussed, we've journeyed together through the complex world of prostate cancer, a disease that affects millions of men worldwide. We started by defining what prostate cancer is, a malignancy that begins in the prostate, a small walnut-sized gland that produces seminal fluid. We then delved into the causes of prostate cancer, which, though not fully understood, are believed to be a combination of age, race, family history, and certain lifestyle factors. The symptoms of prostate cancer can be elusive, often mirroring less serious conditions, but can include difficulties with urination and discomfort in the pelvic area. Diagnosing prostate cancer usually involves a range of tests, from blood tests to biopsies. And as for treatment, there's no one-size-fits-all approach. It can range from active surveillance for low-risk cases to surgery and radiation for more aggressive forms. Knowledge is power. Stay informed, stay healthy, and remember, early detection saves lives.